Well, I'm really excited to be here. I got to warn you guys, you are getting the fuzzy end of the lollipop today. Normally when I do these presentations, I have National Geographic photography that follow my travels around to the place where people are living the longest life. But today what I wanted to do was kind of present my point of view around healthcare and the systems that we have in this country around healthcare. This is my point of view. Like I said, I've never done this before, so please be patient with me. So at the end of the day, 80% of how long we live, according to the Danish twin studies, is based on our environments. Only 20% is healthcare. If that's true, what we at Blue Zones wanted to do was travel the world. See if we can find the pockets in the world where people are living the longest life, where they have the lowest rates of middle-age mortality. Places where they're reaching 100 at rates 10 times higher than they're doing it here in America, and I think more importantly, they do it with a fraction of the disease. Our premise was if we could go in and interview these people that are having such success around longevity, we could reverse engineer longevity, create that recipe. So my brother Dan and I partnered with National Geographic, and we found the 5 demographically confirmed places in the world where people are living the longest life. And by using demographers that looked at birth and death records, by working with public schools of health, as well as doctors that were doing physicals, what we're able to do is find the 9 commonalities that flew through all the different regions we travel. We call them the Power 9. These are simple things. For example, in all my travels, I did not see one health club. I didn't see somebody running a marathon. Instead, their communities were set up for people to move naturally. They had the right outlook in life, these simple techniques to help reduce the chronic swelling that's tied to most age-related diseases. That chronic swelling that creates that inflammation, right? Or they had a strong sense of purpose in their life. Does anybody here know what the 2 most dangerous years of your life are? It's the year that you're born and the year that you retire. You are 30% more likely to die the year that you retire than your last year work. Now, why is that? Is it because you woke up one day and said, you know what, I've been wanting to do that running of the bulls thing? No. We have that sense of purpose. In the Blue Zone communities, whether they're 20 or 100, they had a sense of purpose, and not only had that sense of purpose, but could articulate it. And people who can articulate their sense of purpose live on average 8 years longer. In the Blue Zone communities, they had a healthier diet. They had a healthy relationship with wine. They had a plant-based diet with fruits and vegetables that they grew in their own garden. Unprocessed foods. They had, did they eat meat? Yes, they did. But it was about 4 times a month, and portion size about the size of a deck of cards. So a lot less than we tend to get at the Hungry Heifer. And they also had ate less calories in general. And the bottom piece, which I think holds everything else up, is how they connected as a community. They put their family first. As you age, you're always surrounded by love. They had a strong sense of faith. According to Duke and Harvard University, people who go to church or have faith and show up at least 4 times a month live 4 to 14 years longer, and it doesn't matter what your faith is. And the last one is they had supported networks around their friends that reinforced healthy behaviors, but they also were there when you needed that support. Now, here in America, we are never going to be Okinawa. We're never going to be Sardinia. We're set up on kind of a different place. So what I wanted to do, and again, I apologize about this slide. This slide is something that I created. I think a 5th grader with a good, some crayons could do a better job. So again, I apologize. But if you think about healthcare here in America, and this is my point of view, you start with acute care, right? It's the legacy model that everything is built upon. It's that individual with an expert relationship. It started centuries ago, back before we knew what the term diabetes or chronic heart disease was. It started back when we were dying at 35 from influenza or other infectious diseases. You know, it's an individual to doctor relationship, and over the years, it spread it out to include other things. We even changed who that doctor was, who that expert was, to nurse, practitioners or physician assistants. Take it down the next tier. Social workers might be that expert, or dietitians in our environment. But about 40 years ago, people came up with this term of wellness. And they basically said, you know what we need to do? We need to change the health and start cutting down some of those risk factors before people get sick, because this model right now is too expensive. And they tried to build it under this framework of acute care, by creating plans for those individuals so they wouldn't get sick, right? But the problem is that they missed Behavioral Science 101 class. If I have a heart attack, if I'm told that I have cancer, it's easy for a doctor to create a plan that I'm going to follow, because if I don't follow it, I'm going to die, right? But if I'm trying to get people to do some of the things that I talked about on the Power 9, the downshifting, the move naturally and eat healthy when they're not sick, it's a lot more difficult because you don't have that burden of disease. Hyperbolic discounting is what it's caused. It's what it's called. In other words, I can eat that Big Mac. I can have that cigarette for lunch and that big old Coca-Cola, and I'm not going to die at that time for having it. I will have no consequences because, in fact, I can have it for 5 and 10 years and not be impacted by it. So what the experts said then is, you know what, we need to change this model so that we incentivize people to look into the future, think about their health in the future. And what they did is they incentivized people. They gave them money to do things, to join health clubs and stuff like that. And they found the same thing, it didn't work. It's expensive, but didn't work. So next comes some of these emerging models where people are starting to think about, where do you spend your time? Who are you spending your time with? Who are your relations in your community? What are your environments, those places where you work, live, and play? And how do they help healthier behaviors? Or also, what's your culture in your community, your social norms, your policies, your laws? How does that define? And they found that it actually had more impact than the acute models, and because you didn't need that expert in the relationship. Instead, the fabric and the choice architecture of the community focused on healthier choices, so that you didn't need a treatment management. People were just getting healthier treatment just by interacting in their community. Longevity wasn't something that has to be pursued, it just ensued, right? So now I want you to think about this on a couple different continuums. The first one is around, if you look on the left-hand side, one of the things that is really focused on is the ability of that expert to extract individual will in that individual. And you can do it. You can engage them and extract that individual will, but it's incredibly expensive and it's hard to do. But when you look at the other side, around your families and support networks, when you look at that other side around those ubiquitous nudges in your community that, again, make that healthy choice the easy choice, again, it starts creating habits and creates a choice architecture in that community that makes that healthy choice the default choice. Another line on that continuum is usually around that acute care, choices are temporary. If you pull something out of that, whether it be the expert, the incentive, or whatever, if anything changes in that, now you're focused on that individual will. And if you look at the data, 5% of the people are able to follow through on that plan, 95% fall off when you just focused on individual will. But on the other side of the equation, what you have is semi-permanent and permanent changes to your environment. To making that choice architecture is permanent, and usually they become habitual because you've done them long enough. Now, if you're thinking about a next generation platform tied to this, you can't just think on the right or the left side. It needs to be holistic. It needs to be that whole framework together, because they both have their benefits. But when I look on the right side or the left side, what you end up seeing is it is really focused on individual will. The care tends to be fractional and very inconsistent because it depends on that expert, right? When on the other side, what you start getting is sustainability. What you start getting is these changes start becoming habitual in the community. It's not N1, but it's that whole community is involved in it. You have that tipping point theory. If I get enough of the people in the community to do this, then the behaviors in the community are going to be automatic. More people are going to get on board because it's the social norm in the community. Now, how do you choose what you want to work on? Well, part of it is you have to look at data. And on one side of the equation, you're looking at morbidity rates, mortality. Your decisions are made around costs. And on the other side, you're looking more at that causal data. What's your access to healthier foods? What's the financial literacy and the financial strength? How does your community impact your health? And then when you start looking at those numbers, now what you can do is start developing innovations in your community that hopefully start driving that well-being, start changing that culture. The last thing I want to say around this is it has to be built. The next generation platform has to be built on a digital framework. At the end of the day, guys, my generation spends about 3.5 to 4 hours a day, according to the age data, on my cell phone. This is a huge part of my environment when it comes to my health. And me being that older guy yelling at those millennials, get off your phone. As it turns out, we use this phone more than they do in our life. It's a huge part of our environment. So to kind of, wrap this up, if you think about it right now, the left-hand side, about a $3.2 trillion industry focused on health. You look at that other side around it, it's kind of that new emerging markets. We're still trying to be figured out. There's still a lot of more things we can do with it. And I know a lot of people in this room, this is what you do. Now, when you look at the acute care, right now, it's starting to merge over. What they're starting to try to figure out is how do we do better for caring for that patient and moving into some of those relationship models, right? And on the other side of the equation, what they're trying to do is figure out how does it health for the public and bring it into that acute care model? How do they come together to meet so that you really are creating a new framework around health and wellness and community? Now, it's an ugly slide, but that's kind of my point of view around where health needs to go and what the framework is around our healthcare system today. So, we at Blue Zone Project, after about 9 years of research, back in 2009, decided we want to do some of the lessons that we learned, those Power Nines bring to the communities around America. And what we wanted to focus on is basically this. 80% of what you do is within a 10-mile radius of where you work and where you play. And if you can optimize that environment to make the healthy choice the easy choice, again, longevity doesn't have to be pursued. It just ensues. It just happens. So using some research from a guy named Pekka Puska in North Karelia, Finland, who did the same thing back in the 1970s, we tried to create an architecture that focuses on how do you look at the individual in your individual environment? How do you focus on creating stronger social relationships in your community that really kind of push a good health? I don't know if you guys know this. According to data, 30 years ago, the average American had 3 best friends. That's now down to a friend and a half. And if you can tell me where you get that half a friend, I'd really appreciate it. I think it's social media. 3 Twitters and 2 Facebooks equal. According to research, if you have less than 3 friends, you are defined as lonely, and the impact that has on your body is about the same as smoking 20 cigarettes a day. So how do we break down isolation in community, create more better social networks? How do you give people a sense of purpose, a reason to get up in the morning? How do you look at the environments around where you work, live, and play, where you're spending 80% of your working hour, most of your time, your working hours during the week at your work site? It has a huge impact on your life just by default. And then what are the policies in the community that drive well-being? Policies such as your food systems, tobacco laws and policies, or are your streets built to make it easy to walk and move, or is it too dangerous because we have car-centric communities or that urban sprawl that makes it so you can't age in place? And if you can power on the Power 9 principles, again, you're starting to create a default around healthy communities. Back in 2009, we wanted to see if you can make this work. We partnered with the community of Albert Lea, Minnesota. We had about 70 communities who wanted to pilot this with us. We chose Albert Lea because they had the right leadership. They were really ready to go. We entered that community. It's off the Mississippi River in southern Minnesota. And we didn't go in there saying, this is what you need to do. Instead, we came in there and listened. We really tried to understand what are the strengths, what are the challenges, where are the opportunities in the community? What do you want your community to look like 5, 10 years down the road? And how can we come in and design interventions and design community change so that that healthy choice becomes easier? We started with creating sidewalks that made it safe for people to walk to school, to bike to work, to get to the downtown. The downtown area, they wanted to widen Main Street and increase the speed limit, which I got to tell you guys, it's a great thing to do if you want cars buzzing through the middle of town. But if you're trying to create a place where kids can recreate, if you're trying to create a place where you have outdoor cafes, how smart is it to increase the speed limit? So about a block away, they had this beautiful lake, but no way to grade around. Great place to recreate. So what we did is we had to move the money to create a walking path around that lake. Increased active transportation in that community by over 30%. Didn't have to buy anybody a gym membership. Once it was built, done. Created community gardens where people came together around healthy foods. Worked with this guy on the right named Brian Wansig from the Cornell Food Lab to work with restaurants to try to, again, create a healthier environment. Not to change restaurants and say this is how you have to do business, but just change the choice architecture a little bit. Anybody here, you ever go to a restaurant and they give you that basket of bread? You slather it with butter and you eat it down, and by the time your food comes, you're already full. But our parents taught us a clean plate club, so you got to eat that meal too, right? Well, what Brian said is the restaurant can still serve bread, but what if the customer has to ask for it? Healthy choice, easy choice. Or what if the default with sandwiches instead of fries was healthy fruit or salad? You can still get fries if you want. Healthy choice, the easy choice. We worked with grocery stores to take the healthy foods. We worked with grocery stores to help with that food system and teach healthy cooking classes in the community. What's the last thing you see in a grocery store? Is it a healthy choice? So we blue zone the checkout lanes. So that last impulse buy was a healthy choice. And now you had kids in those checkout lanes going, "Mommy, I want a banana." Havoc, I tell you. We worked with work sites to get people up and running. This is you're sedentary in your work site, so we ended up getting people to move a little bit more throughout the day. And this is an extreme example of what we did. We worked in cafeterias to create a healthier eating environment so that it's easier to find healthier foods in their cafeteria. We created social networks at work sites. According to Gallup, number one thing impacts whether or not you want to go to work is whether or not you have a good friend. Do me a favor, raise your hand if you like going to work with that person that you hate. All right, that's what I thought. There was 2 people, by the way, that raised their hand back there. We worked with Leslie Lytle from the University of North Carolina to change policies in the community, in the schools to really drive wellness, more activity, healthier eating in the school, as well as mindfulness in the school, which I thought was huge. The other thing we did is, anybody here, raise your hand if you walked to school when you were a kid. Did anybody do that? Now raise your hand if your kids or grandkids walk to school. Why have we engineered that exercise out of our kids' lives? Well, people are afraid, right? So what we did is did walking school buses, where kids could get dropped off at a safe location where the teachers or volunteers in the community are looking for something to do could actually walk these kids to school, create a safer environment where you're getting activity. We worked with individuals to look in how do you redesign your homes and the architecture in your homes. How do you create more things to do with your family? We created this concept of Moais, basically asking 8 people who didn't know each other to get together one day a week for 30 minutes to either walk or to eat healthy. According to Walter Willett at the Harvard School, what he ended up saying is 70% of these groups are still around today. These groups didn't exist. These friendships didn't exist before 2009. Now you have a stronger social network. And then we work with Richard Leiter to give purpose. Not only to give people purpose, but to create curated volunteer opportunities where people could then go out and then fulfill that purpose. Now, love the media, whatever. The results, though, is what matters. About 25% of the community participated. Over half of the work sites, absenteeism dropped by 20%. Life expectancy went up. People were doing more steps in the community. As a result, city healthcare claims dropped by 40%. Due to the success of this project, we partnered with a company out of Franklin, Tennessee called ShareCare to really try to scale this up. We started in the Beach Cities community of LA. And everybody goes, oh, they're already healthy, they're already great. But they had stress rates that were comparable to Sierra Leone and inner city Detroit. You have traffic that's out of hand. We went in with Gallup, sampled the community before we started so that we really understood that causal data that I was talking about before. And then we developed strategies that really tried to implement it. And we're really proud of the success. This is between 2010 and 2015. This is what we accomplished, including that we're looking by about 2020, we're projecting to be able to save the community. This is according to Gallup. These are Gallup numbers. About $125 million in cost savings as well as in productivity in the community by changing that environment. The community was doing great work around childhood obesity, but between 2010 2015, with some of the work that we did with them, we dropped childhood obesity rates by 55%. It's now down to 65%. And the Surgeon General went there last year. Obama's Surgeon General came back and said, in the age where poor health seems so intractable, we've taken a community from a place of resignation to a place of hope. Because you've changed that culture, that infrastructure around health. Now, Blue Zones is right now in about 42 communities. We're impacting about 10 million lives. Everything from small towns in Minnesota to Fort Worth, Texas, 800,000 people. It's my job. They can't eat meat. Anybody want my job? I'm teasing. We don't do that. They also make me go to Hawaii, which is very tough. So in closing, because I'm seeing a red light, my time is up. This audience knows this better than anybody else. We have a healthcare crisis here in America. If current trends continue, over 60% of us are going to be overweight. Over 45% are going to be obese. We spend over $3 trillion on diseases that are preventable. And this scares me. For the first time in history, the life expectancy of our kids is less of that of our own. We're supposed to create better generations for our kids. But for some reason, we're failing. And it's not because we're bad parents. It's because our environments have changed. You can't walk down the street, can't fill up a tank of gas, can't walk through an airport, can't turn on a TV without being bombarded by unhealthy messages. You make over 250 decisions every day that impact your health. An individual discipline is good, but discipline is a muscle. And eventually muscles fatigue and you break down and you do that unhealthy act. You do that hyperbolic behavioral issues I was mentioned earlier. The answer lies with you in the communities, not with Washington, D.C., about looking at evidence-based strategies that change the environments in our community to make that healthy choice, easy choice. So as this conference progresses in the next couple days, and I look forward to being able to have conversations with you this as well, think about your job and think about how you can impact and change the culture, the relationships, and the environment of your communities so that that healthy choice becomes the default, so that it's easier for us to have, to be centenarians, to live a longer life. Thank you so much. I appreciate it.